In this video you will learn more information about a serious medical condition, hyperkalemia. Hyperkalemia is a medical condition characterized by elevated levels of potassium in the blood. Potassium is an essential electrolyte that plays a critical role in various physiological processes, including nerve and muscle cell function. Maintaining the proper balance of potassium is vital for normal cellular activity. When levels become too high, it can lead to disturbances in the heart's electrical activity and affect muscle function. Causes of hyperkalemia. Kidney dysfunction. The kidneys are responsible for filtering potassium from the blood and excreting it through urine. Conditions that impair kidney function, such as acute or chronic kidney disease, can result in decreased potassium excretion. Medications. Certain medications can contribute to hyperkalemia, including potassium-sparing diuretics, ACE inhibitors, angiotensin II receptor blockers, ARBs, and nonsteroidal anti-inflammatory drugs, NSAIDs. Adrenal insufficiency. Conditions that affect the adrenal glands and reduce the production of aldosterone, a hormone that helps regulate potassium levels, can lead to hyperkalemia. Severe tissue injury, trauma, burns, or other conditions causing significant cellular damage can release potassium from cells into the bloodstream. Excessive potassium intake. Consuming too much potassium through diet or supplements can contribute to elevated blood potassium levels. Symptoms of hyperkalemia. Mild hyperkalemia may not cause noticeable symptoms. As levels increase, symptoms can include muscle weakness, fatigue, numbness or tingling, irregular heartbeat or palpitations, breathing difficulties. Severe hyperkalemia can lead to cardiac arrest and is a medical emergency. Diagnosis. Blood tests are used to diagnose hyperkalemia by measuring potassium levels in the blood. Additional tests may be done to identify the underlying cause. Treatment. Treatment of hyperkalemia varies and depends on the severity of the condition. Loop diuretics may be used to increase potassium excretion by the kidneys. Insulin helps move potassium into cells. Intravenous insulin with glucose may be administered to lower blood potassium levels. Intravenous calcium can help protect the heart by stabilizing cell membranes. Medications that bind to potassium in the gastrointestinal tract may be prescribed to prevent absorption. In severe cases, especially when associated with kidney failure, dialysis may be necessary to remove excess potassium. Prognosis. The prognosis for hyperkalemia depends on several factors, including the underlying cause, the severity of symptoms, and the promptness of treatment. Mild cases with no significant symptoms may have a favorable prognosis with appropriate management. However, severe hyperkalemia can be life-threatening, and immediate medical attention is crucial. Preventing hyperkalemia. Preventing hyperkalemia involves managing underlying health conditions, being mindful of medications, and maintaining a balanced diet. For individuals at risk of hyperkalemia, such as those with kidney disease or taking medications that affect potassium levels, regular monitoring of blood potassium levels is essential. Follow your healthcare provider's recommendations for scheduled blood tests. If you have conditions such as kidney disease or diabetes, work closely with your healthcare team to manage these conditions effectively. Follow prescribed treatment plans and attend regular checkups. Be aware of medications that can increase potassium levels, such as potassium-sparing diuretics, ACE inhibitors, angiotensin II receptor blockers, ARBs, and nonsteroidal anti-inflammatory drugs, NSAIDs. Inform your healthcare provider about all medications you are taking, including over-the-counter drugs and supplements. Maintain a balanced diet with moderate potassium intake. While potassium is essential, excessive intake can contribute to hyperkalemia. High potassium foods include bananas, oranges, tomatoes, potatoes, and leafy green vegetables. If you have concerns about your diet, consult with a registered dietitian for personalized advice. Adequate hydration is essential for kidney function. Ensure you are drinking enough fluids, but consult with your healthcare provider about your specific fluid needs. Some salt substitutes contain potassium chloride, which can contribute to elevated potassium levels. Check the labels of such products and if in doubt, consult your healthcare provider. Regular physical activity can help maintain overall health, including kidney function. Excessive alcohol consumption can affect kidney function. Limit alcohol intake and, if possible, avoid binge drinking. Adhere to the advice and treatment plans provided by your healthcare team. Report any symptoms or side effects promptly. Regular communication with healthcare providers and a proactive approach to managing health can contribute to effective prevention. Thank you for watching. Please subscribe to our channel for more such contents.
The information provided here is for educational and informational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have read or heard in this content. If you think you may have a medical emergency, call your doctor or emergency services immediately.